Hi everyone. I had a lot of questions lately in regards bottles and breastfed babies and a technique that's called paced bottle feeding. So today I want to talk to you about this and why it's important for your baby, for you to be using that technique for them. So paced bottle feeding is a feeding technique that it will allow your baby to be in charge of the way he feeds when he's at the bottle. The difference between breast and the bottle is that when baby is at it's at the breast, he will be in charge of the flow of the amount of milk he is getting. So whenever your baby stops sucking, the flow will stop as well or slow down. Sometimes, depending on the brand of the bottle you have, this doesn't really happen. So if you would have bottles that have either like a too big teeth or the flow is too fast for your baby, he will not have any other choice than to keep gulping down, keep sucking. So how to tell if the flow is too fast is to take your bottle and like tilt it upside down. Some bottles will not drip, but some bottles will. So the ones that don't drip, they will have a slower flow. Or bottles who are meant for newborns, bottles who are meant for premature babies, slow flow bottles really. Why considering this technique for your baby really? You can consider this technique either if you're bottle feeding, or mixed feeding, or doing a bit of everything. It will help your baby set up the pace of the feed. It will help him not overfeed. It will help your baby not get very gassy and colicky because he's so overwhelmed by the amount of milk he's getting in one go. So just imagine yourself like being really, really hungry. And if you have a big plate of food in front of you and it looks really, really delicious, well, you will try, if you gobble everything in one go, at the end of it, you will feel very heavy in your tummy and you'll feel, not very well. But if you pace yourself and you take little bites and you take breaks and you allow yourself to, for the food to settle, for your tummy to talk to your brain and kind of like signal from one to the other that, I'm actually full and we don't need to finish this plate. It will be, you will be feeling full, but not with a heavy tummy, and so maybe unwell at the end of a feed. So this is what we would like to do for babies as well. Sometimes babies are ravenous at the beginning of the feed. They will go from 0 to 100 in a few seconds. So if you got one of those babies, they might protest when you stop the bottle, but ultimately it will be better for them. So what you're aiming for when you're feeding your baby is to have your baby really nicely upright on you. And then, so they will be supported in your arm. There we are. Supported in your arm, resting on your lap. And you will be aiming to offer them the bottle, wait with the bottle at the tip of the top lip, wait for them to open their mouth wide, and then introduce the bottle in their mouth. This will help to maintain continuation with what you're doing at the breast if you're breastfeeding. So when you're latching the baby at the breast, you're touching your nipple here, you're waiting for your baby to open wide, and then you bring the baby to the breast. So you would like to keep the same thing when you're using bottles. So tickling the baby at the top lip, stimulating, him to open his mouth, and then introducing the bottle. You would want to maintain the bottle as horizontally as you can. And baby being upright and bottle being horizontal, he will be able to stop whenever he wants to take a break. You will notice your baby will start sucking, but he will have moments where he will like and just stay and not do anything and pause. And that's how you know that you're doing this technique correctly, because baby has that opportunity to kind of like pace and stop, to allow himself to take a moment and then start sucking again when he's ready. By the end of the feed, you will definitely end up tilting the bottle so the milk, covers the teat and baby doesn't get too much air in. So you will start at the horizontal point and you will end up tilting the bottle as you get towards the end of the feed. But you will not be aiming to do this. So baby is not lying down, all right? So baby never lies down. So you tilt the bottle always. Baby is nicely, nicely upright, resting on your lap and on your hand, really. Stop along the feed. I would say stop every 30-40 mils, depends on the amount you go in the bottle. Give your baby a few minutes upright on your shoulder. Give opportunities for the baby to burp. Even if he doesn't really burp, again, these opportunities are opportunities for the baby's tummy to talk to their little brain and communicate and figure out if they're full or not. When you go back to feeding, you will be doing the same thing. So you will be touching the top lip, waiting the baby to open wide and to start to open his mouth when he's ready to get the bottle in. If your baby, if you still have milk in the bottle, don't always push your baby to finish the bottle. If the baby's not interested to take the feed, to take your bottle, don't really shove it in. He might be ready to stop sooner than other times. It's normal for the feeds to sometimes be, full feeds, for the baby to take the last drop of milk that's in the bottle, and sometimes to be interested to take less. Very, very normal. And it will be just like sometimes having a little breakfast and then a mid-morning snack, and then you have a bigger lunch and then another snack maybe before the next meal. So bigger feeds, smaller feeds, the same thing. Yeah, so this has been the paste bottle feeding technique. This will help baby to cope better with colics. It will not overwhelm the digestive system, and it will prevent overfeeding in babies. I hope you find it useful. Keep an eye on the channel for future tips on breastfeeding. Bye.